Pop quiz. You've got open time in the doctor's chair and you got the hygiene chair. Which one do you work on first? I'm going to challenge you on this one. I'm going to tell you it's the hygiene chair. Counterintuitive, but listen to me. I want you to listen to the reason why. Hygiene is a lower barrier to cross for the patient. You think about it, it's not a big heavy decision to say yes to a hygiene patient to appointment. If it's been a little while, they haven't been in, or it's time for them to get in, it's time to bring them back in. Especially if patients have missing restorative work and they haven't come in. So we want to shoot for the hygiene side first. If they have unfinished restorative work, there's some kind of drama going on inside the old noggin here. And so you've got to figure out what it is. And your job is to overcome the obstacles. So if you bring those people back in through hygiene first, it's an easy yes for them to say, come in. It's your chance to reestablish that trust, the know, the like factor, and to figure out what's holding them up. And you can do it in real time, get them established in what the objection is. Because if they haven't done it, something's going on. And if you try to do it through an email or phone call or even sending something in the mail, it's never going to be as effective as knee to knee talking about what's holding them up and overcoming all of that. The healthiest practices have a good balance of a hygiene schedule that is full, that feeds the restorative practice. You've got to have a hygienist that knows restorative, who can tee that up and talk to patients about what they need. You know, it's not about just scraping their gums and scraping their teeth and sending them out the door. We're talking about overall health, and that talks about maintenance and structure and function and foundation. And so your hygienist has to be really comfortable with that. And if they're not, this is your chance to say, hey, this is my philosophy on practice. This is what we want to do for patients. We want to give them the best of both worlds. We would never give them a foundation without a roof on their house. We want them to have the whole thing. So when you have that balance, your schedule will be fuller. Your patients are going to trust the hygienist, trust you, and trust everything you're doing because you are in there to help them to make it happen. So remember, make sure the hygiene schedule is full and it's filled with people who know what they're doing and talking to people to overcome all those problems and get them scheduled. Hey, if you haven't done it yet, make sure you go over to my website at gingerbratzel.com/patients and request my free checklist to help you get and keep all the patients you need. We're talking about your ideal patients, the ones that are perfect for you to make your practice go smoothly. It's free, it's over there. Just clicky, clicky, click, push send, and my little elves will float it off to you right to your inbox. Take care.